Hi everybody, this is a video about the difference between Lyme and reactivated Lyme. Someone posted this question on one of my other videos, and thank you for the question. And that was the question: what's the difference between Lyme and reactivated Lyme? So the Lyme disease itself is a very specific disease. It has a very specific set of diagnostic criteria and symptoms and things to that effect. And it's basically the type of Lyme disease that every healthcare professional learns about in their healthcare professional school, medical school, naturopathic doctor school, chiropractic school, whatever. We all learn about just kind of regular old Lyme disease. And then there's other manifestations of illness that can be related to the bacteria that causes Lyme disease, also known as Borrelia burgdorferi, which in some cases could be a reactivated form of Lyme in a sense. It could be a chronic manifestation. There's different scenarios that could occur. So the question specifically was about acute Lyme disease. So acute Lyme disease would generally be one gets infected with the Lyme bacteria, this Borrelia burgdorferi. In many cases, that might be from a tick bite. It could potentially be from another mode of transmission, potentially. That tick bite might lead to a bullseye rash. It might not. It might lead to some other type of rash. Only about 30% or so of patients with Lyme disease actually have like a stereotypical bullseye rash. There could be other rashes. Some people don't have a rash at all. So when the person gets that infection, then they develop fatigue, joint pain. Sometimes they will have brain fog. Sometimes they might have some cardiac symptoms, but generally with acute Lyme disease, it's pretty much fatigue and joint pain. Oftentimes one or both knees is involved, but there could be other joints that are involved. If that acute Lyme disease isn't treated in a timely fashion and it starts to become subacute or eventually what they call late stage Lyme, or technically it's chronic Lyme at that point, then there could be more notable involvement with the nervous system. Could cause Bell's palsy, like partial facial paralysis. Could cause brain inflammation. Could cause inflammation or damage to the heart, and so it gets a lot more serious. So that's kind of acute Lyme disease, or just kind of regular old Lyme disease. Reactivated Lyme is technically not a thing, just in that Lyme disease is a very specific entity and it's not supposed to be able to get reactivated. However, I'm going semantics a little bit here. I think the nature of your question, or the spirit of your question, is a person who maybe had Lyme and then it gets reactivated in their system. Technically that would be more of like a borreliosis recurrence. Anyways, some people get a little bit hung up on the language around it, but in essence, if a person had Lyme in their body, like they had a Lyme infection, whether they had the symptoms of acute Lyme disease or not, and that Lyme bacteria, that Borrelia burgdorferi, isn't fully eradicated from the body, it could go into dormancy. Lyme bacteria can hide out behind biofilms. It can go into this dormant form that's most appropriately called a round body form, sometimes known as an L form or a cystic form, and it can just hide out. And it can wait until a rainy day when the immune system is preoccupied due to mold toxicity, too much stress, nutrient deficiencies, other things that might cause mitochondrial dysfunction, methylation pathway defects, whatever it happens to be. And then it says, aha, now is my time to strike. And then it starts to manifest a significant reaction or significant symptoms. And in those patients where there might be this, kind of reactivation happening, it would be quite common that it would be more chronic and insidious symptoms that would be seeping in. It wouldn't be so much of it's fine one day and then suddenly I've broke out in a bullseye rash and I have a couple of sore joints and I'm feeling tired. It would more likely manifest as I'm feeling gradually worse and worse. I'm getting more and more aches and pains, maybe migrating joint pain, getting brain fog, getting maybe inexplicable neurological symptoms, having body temperature fluctuations. Could be, there's dozens of symptoms that could be associated with persistent manifestations of borreliosis. So that would be the type of scenario that might lead to more of a reactivation of that type of infection. So I could kind of go on and on about this, but I hope that I've answered the question that you asked. If you have a follow-up to this, or if anybody else has a follow-up to this, please post in the comment section below, and I'll do my best to answer as best I can as soon as I'm able to.